And joining me now from the White House is Vice President Mike Pence. Mr. Vice President, welcome back to Meet the Press. And I want to just start simply with what some governors have had to say on the issue of testing. Take a listen, sir.
There needs to be more testing infrastructure, more test kits, more capacity to test.
We need some assistance from the federal government when it comes to swabs and reagents.
One of our problems for our hospitals who are doing the testing is lack of reagents, and this does lie with the FDA.
They set the expectation very high, but then they didn't send the cartridges to actually do the test.
We now, I think, have put in 7 to 9 orders to FEMA and not received anything.
This is mayhem. We need a coordinated approach between the federal government and the states.
I'm sure, Mr. Vice President, you probably can recognize the voice of all 50 governors these days because of how often you're on the phone with them. But those were 3 Republicans and 3 Democrats. And I know you're hearing this, and it has to do with the new guidelines that seem to indicate that states have to take the lead on testing. It seems as if every governor is basically saying they'd love to do that, but they need the federal government's help to do it. Why doesn't the president want the federal government to be the lead on testing?
Well, Chuck, thanks for having me on. And it really is remarkable to think about the progress the American people have made over the last several months. When the president tapped me to lead the White House Coronavirus Task Force, he gave us the first objective is to save lives and to focus on slowing the spread, bending the curve. And because of the extraordinary efforts of the American people, we continue to see every day evidence that cases are declining, hospitalizations are declining. That's a tribute to the American people. Frankly, it's a tribute to all of those governors in both parties across the country who've put these mitigation efforts into effect. Secondly, the president made it clear to us that we were to make sure that hospitals in impacted areas had the resources and the equipment that they needed to be able to save as many lives as possible. And I have to tell you, the tens of millions of personal protective equipment that we've coordinated for delivery around the country, especially in areas most impacted, and the fact that ventilators have been delivered in areas across the country so that no American who needed a ventilator has ever been denied a ventilator. We're actually increasing the stockpile today. But testing has been a focus of ours as well from very beginning, and it's the reason why the president early on brought in this vast array of commercial labs that took us from 80,000 tests 1 month ago to now 4 million tests as of yesterday. And as we'll make clear again to governors tomorrow on our weekly conference call, we look forward to continuing to partner with governors all across the country as we continue to scale testing because we really believe that while we're doing 150,000 tests a day now, that if states around the country will activate all of the laboratories that are available in their states, we could more than double that overnight and literally be doing hundreds of thousands of more tests per day in a very short period of time. But Chuck, just so we're very clear, when the president outlined his guidelines for opening up America, we laid out a plan for both for when and how we thought it was best, according to our best scientists and advisors, for states to be able to responsibly and safely reopen. And we believe today, as Dr. Birx has said, as Dr. Fauci and others have said, is that there is a sufficient capacity of testing across the country today for any state in America to go to a phase 1 level, which contemplates testing people that have symptoms of the coronavirus and also doing the kind of monitoring of vulnerable populations in our cities, in our nursing homes, that we ought to be watching very carefully for outbreaks of the coronavirus. But we believe if working with the governors, as we'll continue to partner with them, that we can activate labs around the country and that states today, if the governor so chooses, have sufficient testing to be able to move into the testing contemplated in phase 1.
Do you believe governors are not activating their testing capacity? I mean, these governors have said they'd love to enhance their capacity, but they're missing swabs, or they're missing the reagents, Or, you know, in one cases, Governor DeWine has told me that they've been rationed. That is what, you know, I guess the question is this: why haven't you used the Defense Production Act to basically get swabs and reagents prioritized?
What we've done through FEMA and through U.S. Public Health Service is literally marshal the full resources of the American economy. We've been bringing medical supplies, including testing supplies, in from all over the world, and we'll continue to do that. But as you said, Chuck, I've been working almost daily over the last 2 months with Republican and Democrat governors across the country. And this vast and complex system of testing, using the commercial labs around the country and using hospital and public labs, is a new concept. And so we've been working with governors around the country to make sure that they and their health officials know about all the resources in their states. And we also have deployed a team from Walter Reed that over the last 2 weeks has been calling every single laboratory in the country that can do coronavirus testing. And tomorrow we'll be presenting all of those details to governors so that they can activate those tests in their state.
Mr. Vice President, aren't you making the case of why this needs to be nationally coordinated? I mean, you just said you've identified this capacity, you've identified this. This is why I think a lot of governors have said the federal government has to play point on testing. Is there even a single person whose sole focus is on what is happening with our testing strategy in this country, and how are we going to expand it?
Chuck, we actually have coordinated it at the federal level. Admiral Brett Giroir of the U.S. Public Health Service spends all of his time coordinating testing, deployment, and resources deployment from FEMA. And what we're making clear to governors, and I want the American people to know, is that we will continue to do that. While the President has made it clear that we want the governors to implement testing and deploy testing where they deem it's most appropriate in their state, we're going to continue to fully partner with states around the country to increase the supply, to make sure that they have the reagents and the test kits necessary to perform those tests. But I want to say again, it is truly it's a tribute to the President's leadership that early on in this process, he brought in the top commercial labs in the country. They formed an alliance, and we went from 1 month ago to 80,000 tests being done to 4 million tests being completed as of yesterday. We'll continue to increase that. We'll continue to make governors aware of that. But our approach from the beginning, Chuck, has been we want in any healthcare crisis, we want to make sure the healthcare workers at the local level have the resources they need because it's locally executed. It is state managed, but it's federally supported. And the federal government at the President's direction will continue to support governors as they deploy the testing resources in the time and manner of their choosing. But we believe today, as Dr. Deborah Birx has confirmed, is we have a sufficient capacity of testing today for any state in America to move into phase 1 and begin the process of reopening their state and their economy.
Who should pay for the contact tracing? Is that going to be the states? Is it individual companies? Or should the federal government, since you're requiring contact tracing be a part of this, is the federal government going to pay for that?
The CDC is deployed across the country today, literally in every state. But at the President's direction, as we announced last week, the CDC is going to deploy teams in every single state in the country to do contact tracing over the next 12 to 18 months. The CDC is really the expert at contact tracing, and it really is, Chuck, the way that we typically control the outbreak of infectious disease. You identify someone who has symptoms, you test them, and then you immediately find out who they've been in contact with. That's what the CDC does. And as we announced last week, we'll be deploying coronavirus CDC teams in every state in the country on top of the hundreds of CDC personnel that are already embedded in states today.
Is one of the reasons we're behind on testing because of I saw the FDA came out and said basically the CDC's initial test was faulty, that they found a lot of bad parameters that weren't or guidelines that weren't followed that ended up having that. How much did that set us back as a country? How many lives, unfortunately, might have been lost due to this faulty test kit?
I've seen that report in the papers this morning, and I know that HHS is making inquiries, but we believe those issues were resolved on that particular test by early February. But it's important for your viewers to know that that test, the slow lab-based test that is typical for CDC and public health labs, would never have been able to meet the needs of testing in this coronavirus epidemic. That's why President Trump was so right when he brought together these commercial labs and formed a consortium and literally took us from, at that time in February, we had done some 20,000 tests total across the country.
Right.
Now we've done more than 4 million.
This isn't nationally
we believe
coordinated.
we'll have done more than 5 million tests before the end of this month. None of that would have been possible without the President's leadership, without the innovation, without the incredible efforts of companies like Roche and Abbott Laboratories. And the American people can be confident that whether it is supplies, whether it is testing, we're going to continue to make sure that our governors, our state healthcare officials, and most especially our healthcare workers have the resources and the support they need. But I want the American people to know that sitting here this morning, we really are seeing encouraging signs because of what the American people have done. We believe we are slowing the spread. There's a downward trajectory beginning in even some of the hot spots around the country. And now more than ever, it's important that each of us continue to do our part. And I can assure the American people that at the President's direction, we'll continue to play our role. We'll have a full partnership with governors around the country. And we will
ask you about the
someday
President.
in the near future, we will put the coronavirus in the past.
Let me ask you about the President's tweets on Friday. He wants to liberate Minnesota, liberate Michigan, liberate Virginia. All three states have issued guidelines that follow the national advice that you've been giving them. They're following the President's guidelines to the best of their ability. Can you explain what the President is trying to liberate Minnesota from? I don't quite understand that use of language.
Well, no one wants to reopen America more than President Donald Trump. And I think the American people have known that from weeks ago when the President declared that important balance. We have to make sure that the cure isn't worse than the disease, because the reality is that for all of the sacrifices the American people have made, sacrifices that literally have saved lives, the truth is that there are real costs, including the health and well-being of the American people, to continue to go through the shutdown that we're in today. And so the President laid out new guidelines for every state in the country.
I understand that.
To say that if you've seen cases decline for 14 days, if you're in a position to do the kind of testing and you have the health hospital capacity, that we want to encourage every state to examine the way to go to phase 1. And that's the new guidance that we're giving.
I understand that. I've given you a lot of leeway here. I've not been wanting to interrupt you. That's not true. I always want to jump in on some things. I've given you a lot of leeway. Why is the President trying to undermine the guidance you've been laying out? And that he laid out this guidance on Thursday and undermined it on Friday.
Chuck, I don't accept your premise, and I don't think most Americans do either. The President's made it clear he wants to reopen America, and we laid out guidelines for every state in the country to safely and responsibly reopen their economy at the time and manner of their choosing. We laid out the criteria for when our best scientists believe that would be appropriate, if there was 14 days of declining cases and they had proper hospital capacity, and we laid out the means that they could move into phase 1. When you hear the President, when you see people across the country talking about reopening, every American and this President want to do that in a safe and responsible way. The guidelines for opening up America are a framework for doing that, and we'll work with governors across the country to implement those, because we want to put America back to work as soon as we responsibly can. And at the President's direction, we're going to continue to work to do that every day.
It does seem as if the President wants credit for reopening the economy and he wants the governors to get the blame for not opening it fast enough. That's what the tweet seems to imply, that he doesn't want to own the responsibility of these necessary shutdowns.
The American people can be confident that this president wants to reopen the American economy as soon as we can safely and responsibly do it. But we believe with the guidelines to open up America again. We've given governors around the country our very best counsel about how they can do just that. And we'll continue to work with governors to make sure that they have the guidance, that they have the counsel, and they have the resources to accomplish that. And to put the coronavirus in the past someday, and to put America back to work.
And I just want to clarify one other thing. You said that you believe 5 million tests by the end of April is a success story. The fact that we have yet to that will mean we have yet to test 2% of the population. That is a success story on testing?
Chuck, we believe that under the phase 1 criteria that we have a sufficient amount of testing at that level to allow states to begin to responsibly reopen. And literally doing more than 150,000 tests a day now, a number that we believe we could double once we activate all the laboratories around the country. We're confident that that would enable any governor who's otherwise met the criteria of 14 days of declining cases to be able to have the testing capacity sufficient to monitor people that may have symptoms so we can identify them and do contact tracing, and also deploy the resources to vulnerable populations, nursing homes, and particular vulnerable populations in our city to ensure that we don't see a resurgence of the coronavirus. So yes, we think we've laid a strong foundation for testing for phase 1, and we're going to continue to expand testing going forward for the nation in the weeks and months ahead.
Mr. Vice President, it was nice to see some normalcy yesterday at the graduation ceremony at the Air Force Academy. I think a lot of people are hoping for more and more normalcy when the time is right. Thank you for coming on and sharing the administration's perspective.